Hello, this is We Talk Health, and I'm Keith Sherley. Glad you're with us today. Very special guests, and you're going to want to pay attention because there's going to be a lot of information coming out here. This is very important work. The eICU is going on here at West Tennessee Healthcare, and I'm going to let my guests introduce themselves. Who are you?
My name is Jason Cottle.
Hi, Jason.
I'm an eICU nurse with West Tennessee Healthcare. I've been an employee with West Tennessee Healthcare since 2009. Started prior to nursing in the ER. I've been an ICU nurse since 2011 with West Tennessee Healthcare. Left them for a little while, traveled for about 5 years, but I came back in 2023 to CCU and had the opportunity to come over and work for Audrey in the eICU in February of this year.
Audrey?
Hi.
Hi. Tell me about yourself.
I am Audrey Trammell. I'm the Director of Remote Patient Monitoring here at West Tennessee Healthcare. That encompasses not only the eICU, but also our centralized monitoring unit and virtual care. I have been with West Tennessee Healthcare since 2008, was a nurse on a cardiac progressive floor, and then transferred to the CVICU. And then I worked in case management for a couple years, and I left for a couple years and came back in 2023, worked in CVICU prior to transferring over to remote patient monitoring.
What is eICU? It's a little e.
Yes.
Why is that?
That stands for electronic.
Okay.
And so it is a virtual ICU where we are located off of the main hospital campus. We are actually in the system support building out by the ballpark. And we are able to use two-way audio-visual equipment to remote into patients' rooms. And then we have our own platform called eCare Manager, where it does a whole lot of fancy things, and it runs patients' numbers and vital signs and lab work through, and comes up with predictions on do they think this patient is ready for discharge? What is the chance of mortality? It picks up on microtrends. So it's constantly evaluating where the patient's vital signs are and where the patient's lab work is to be able to make predictions.
Jason, no offense. This sounds like it's doing your job.
It does, but it still takes a mastermind behind the curtain.
Okay,
So,
where do you fit into that?
well, I'm the wizard behind the curtain.
Okay, tell me about that.
Well, we come in. Well, first of all, I'm techie. I'm a little nerdy, so I love this. It's like the intersection of where healthcare meets modern technology.
Okay,
And I love that. So it's pulling algorithms in from Philips and from Epic, a lot of the different.
now what does that mean?
Epic is a platform where we chart all of our patient information. It's where their electronic medical records are stored.
Okay,
Private, privileged healthcare information, of course, obviously secured. But Philips is like our monitoring systems, like where you can see their vital signs and things trending. So this eCare Manager that Audrey mentioned, that's pulling in all these algorithms from these two different platforms. And I'm just the monkey turning the wheels. I'm looking. Honestly, it's intuitive. And that's why it does require, and one of the requirements is that you have an extensive ICU background. With that background, the mechanics are very intuitive. They make sense because you've seen them all your career.
okay.
So you're watching these numbers, you're watching these trends, and like Audrey said, it's given you predictability factors such as discharge readiness. Hopefully we can help shorten up some of these ICU stays. We're watching these numbers. Hopefully we can help with the mortality rate predictions. We can help see when a patient's going bad before they truly get there. It's almost like a crystal ball, if you will, where we're looking and we're seeing what the possible outcomes are, and we're making sure that information is in the hands of the bedside nurses and the intensivists that need that information to help care for the patient. We're just an extra layer of support for those patients.
Okay, so for those listening that are inquisitive, as I am, but not particularly nerdy and not medically inclined, I want to ask some simple questions. And let's start with, why is it important that you be able to monitor and not be, or is it important that you can monitor and not be on site? Because the first thing you said is we do this all with cameras and I guess following equipment and things that they're hooked up to. Why is it important that you not be on site, or does that matter?
Well, we have the advantage of being able to monitor patients at Jackson Madison County General Hospital, Dyersburg patients, Milan patients, Martin patients, Camden, and Bolivar. So us being at a central location in our own little hub, we're not necessarily tied with any particular hospital. We're more for support for the system.
So what does that mean to efficiency and also effectiveness? I would think the efficiency comes in that you can monitor more than one hospital. So you don't have to have bodies physically at all of these ICUs around. So you can be efficient. So is there an efficiency and is there an effectiveness to it? Does it improve the quality of care?
It is very efficient. The eICU model is a complement model to ICU care. We are not a replacement in any way. So in the eICU or in a bedside ICU, typical nurse-patient ratio would be 2 patients to every 1 nurse. In the eICU, we can handle anywhere from 30 to 50 patients per nurse. So we're the 30,000-foot view, which allows us to have those higher nurse-patient ratios.
Jason, have you been a bedside ICU nurse?
Absolutely. For going on 15 years, I was a bedside ICU.
Is it important for the job that you do to have had that experience?
Absolutely. I could not be a shepherd of this information without the knowledge that I gained from bedside.
Are you one of the nurses that Audrey's talking about that handles so many more patients electronically?
That's correct. That's correct. I have on like Audrey said, I can handle from 30 to 50 patients that I could be monitoring at any time, at any given time, from various locations across West Tennessee Healthcare.
Okay. What does that monitoring actually look like? And do you communicate with the nurses, or do they come back and look at a wall, or are we on the USS Enterprise? This is Captain Kirk. How are we actually making this work?
Well, I'm beaming in over their TV.
Okay.
But we have several different modes of communication with the bedside nurse. Obviously, there's still the landlines, telephones. We have a secure chat through through the EMR, and then also we have video. We have the AV function, the video chat that we come in through the television equipment's there with the cameras, speakers. We can communicate with them in that respect as well.
In the room?
In the room.
Okay. And the patient is?
Absolutely. The patient, I mean, we round on all of our patients once a day. Obviously, we try to round by acuity. So when we come in, these numbers that are running, we can trend them by our highest acuity, which is called our automated acuity. Then we also have an automated acuity trim, which we call our Delta score. Those are the ones that are the sickest, the ones acuity sick, the sickest patient, and the patient that's that is like digressing, getting worse. To put it maybe in layman's terms, worse, but we call that a Delta score, a automated acuity trend. And that's the way I sort mine when I'm setting my day up. And I try to round on those patients first. Those are the patients that that look like they need my attention the most. It's not that the bedside nurse doesn't see them, because they do an outstanding job. West Tennessee Healthcare has an amazing staff, and every ICU that I've ever been a part of is stocked with great ICU nurses. So it's not that I'm doing anything any different than they could do. It's just that I'm another set of hands doing it. I'm an extra resource. Sometimes some days are busy for the bedside nurse. It would be nice, just coming from the bedside myself, to have had somebody keeping an extra eye on my patients. Hey, did you see these labs? Hey, did you notice that this heart rate is trending up? This patient appears to be sicker on paper. I cameraed in the room. This patient doesn't look well. You know, we're
so
not
the
there.
heart rate trending up, that may be an example that let me jump in there and ask you about that, Jason. So when the bedside nurse comes in, she gets a snapshot of what the patient's vitals are at that moment. Mm-hmm. Something might have happened 5 minutes before, 10 minutes before she came in overnight, and she can't sit there and read that whole tape like a ticker tape can. Your equipment, Audrey, your equipment that you have, that you provide for the Jasons, they're reading those. The computer is monitoring all those things. Is that correct?
Yes. Continuously 24/7 throughout the entire ICU stay.
Okay. And that equipment that's monitoring the patient's heart rate and labs and vitals and, I guess, respiration and, you know, how comfortably they're resting or whatever those things are, those get analyzed by equipment. And then, Jason, somebody like you looks at that and go, hey, telling the bedside nurse, this is what's went in here overnight.
Exactly. And it's not information that they don't have readily abundant at their fingertips as well. If they're in the ICU, they're on a monitor. Those nurses see the same thing we're seeing. But that's the beauty of technology, is that they're at the bedside. I'm at, as Audrey said, our remote location, and I can see the same things. I can see the same trends. I can see the same real-time vital signs that let me know how this patient's, doing. Are they trending up? Are they trending down? Are they getting sicker? Are they getting better? And these are all things that, like I said, I'm an extra layer of support. I'm another set of eyes. I'm another highly trained ICU nurse that is just there to help support their care.
Audrey, would this be the equivalent of having a nurse sitting by each bed watching everything, as your Jasons, all the Jasons that you have can go back and look at this, that the equipment itself is bedside all the time, reading whatever's going on and giving you that information that a bedside nurse can't do because they're moving constantly?
Yeah, that's exactly it. It's in the background. It's always there, constantly evaluating, doing surveillance on what the vital signs are. And then we have an extra advantage where if we do see something, we can remote into the room via the camera to see, does it match, is what the computer's telling us match what is actually going on with the patient? Or it could be that, is this a time we need to reach out to the bedside team immediately? So it gives us, information. Technology has its limitations, but that's exactly what it is. It's constantly watching all of those micro trends. Our technology allows for it to run through algorithms and make predictions. That's the biggest piece of what it is. They're taking each patient's data and comparing it to thousands and thousands of other patients to make a determination. Is this patient ready to discharge from the ICU? Is this patient likely to get worse over the next 24 hours? And so it just kind of helps us see things that are happening maybe before they happen.
We're and like Audrey said earlier, we're not there as a replacement. We are basically an extension of that bedside nurse. Obviously, with limitations being remote, but we are an extension. We are there monitoring, like Audrey said, those labs, those trends, that patient's progress, whether it's better or worse. But we are just an extension and a supporting factor for that bedside team.
Okay, so is this going on right now in all of the ICUs across the West Tennessee healthcare system?
So right now we are currently live in Dyersburg, Martin, Milan. And then we have carts in the emergency departments that are connected to the eICU at those 3 hospitals and Bolivar and Camden. And then we are live in the SICU here at Jackson and the MICU.
ICU too. Well, MS, what?
The surgical ICU and the medical ICU.
Okay. Surgical, I might have gotten. Medical, I would have gone maternity. I don't know why. That's just the thing that popped in there. I thought about. Okay, so which of you wants to field this question, or maybe both of you might have an opinion, and that is, how does all of this equate or affect patient care? As an ICU patient, how does this affect my quality of care?
Honestly, it probably depends on your location partially. If you are in one of the community hospitals, it does connect you to another set of experienced healthcare providers. And then hopefully it will either have patients to stay in the ICUs in the community hospitals or be transferred sooner from the community hospitals to maybe here at Jackson or somewhere else. For our ERs, where we are able to use the AV equipment and eCare Manager, the whole eICU, that also allows for an extra set of eyes in the most critical patients at our community hospitals that may be waiting on transport, or maybe they want to connect the patient with the eICU to determine, is transporting that patient appropriate, or is it more appropriate to allow this patient to stay in the community hospital? Patients and families, Jackson is not a close drive for everyone. So we're hopeful that this technology and this level of care will allow some patients to be able to stay in the hospital that's closest to their community.
You've been bedside. You now do this. How do you see this as impacting patient care?
When you're talking with your patients, when I was a bedside nurse, a lot of them, when you ask them about their hopes, their goals for their healthcare stay, a lot of them say, I want to get back home to my dogs. I want to get back home to my family. I want to be, so like Audrey said, I think this impacts the community by being able to, for those patients that we are able to keep them closer to home. Family members don't have to make an hour and a half drive to Jackson to come see them. They can drive down the street to the local, to the hospital there in their community and see them. I think that makes a big difference. And a lot of times we all know mindset plays a lot in recovery and healthcare. You see patients who are motivated to get better generally get better quicker. I think patients who have that, I think we're allowing them something they didn't have before, and that's the opportunity to receive the mission statement that West Tennessee Healthcare has, right? Competent, compassionate health care right there in their community without having to be transferred to Jackson to do it. That's one of the goals of, like Audrey said, that hopefully we can allow them to be able to stay there in their community and help them, keep them there and still get that competent, compassionate health care.
What is the day in the life of an ICU patient like?
It varies. We talked about acuity earlier, which is like how sick they are. There's no sleep in a hospital. So really a day, you've got nurses in and out 24/7, coming in, whether it's to take temperatures, do assessments, draw labs, bring medicine, check on the patient. We notice you might notice a trend in vital signs where you want to lay eyes on the patient. You go in and you look at them. So a day in the life of an ICU patient is it's hectic. There's there's not much sleep in the hospital.
Fear.
Absolutely.
Anxiety.
You're taking care of people in some of the most vulnerable times in their lives. And I've never taken that for granted. That's one thing I always try to keep in the forefront of my mind, is that I'm caring for somebody in probably one of the more vulnerable times in their lives. Fear is definitely plays a part in some of their minds. Anxiety, the what ifs that we can all do in any aspect of life, especially if you're in a hospital and you're sick and you've just been told that you have a disease process that maybe you know very little about or not at all. So yeah, we're there to be that compassionate, competent. We're the keepers at the door. The nurses are. So we're there to make sure they get the care, they get it compassionately, but then that we are also make sure that they understand the information, that they understand. Doctor goes in and talks to them like, "Hey, did you understand all of that? Did you have any questions?" We're the facilitators, if you will, of making sure those patients understand their health care, what they're getting, how they're being treated, how it's going to affect their life moving forward. Upon discharge, we do discharge paperwork with them that we talk about healthy diets, healthy lifestyle, the changes in their lifestyle. And these are all things that the ICU patient, these are things that they're going to experience while they're in the hospital.
Can I add? I have something to add.
Please do.
To how we're impactful. The eICU, not only are we, in the background with the surveillance and all that type of thing, so we're also trying to offload tasks from the bedside nurses and the bedside teams. So say you have a patient that is critically ill, and all of the nurses on that pod need to be with that patient at that time. We now have the availability to have eyes on all the other patients in that pod at the same time. So they're being watched, whereas not that they weren't being watched before. It's just there's just an immediate person there with them.
You've got oversight that means that other patients don't have to sacrifice their quality of care. Their quality of care is not going to be sacrificed or impeded or interfered with if, for whatever time, every physical nurse needs to be bedside with somebody else. These patients are still being cared for and monitored and watched in every way, just as they were.
Right. And, I worked bedside as a nurse for a long time, like Jason, and I know I would feel better if I was with the most critical patient at a time and the whole team needed to be there. The bedside team needed to be there. I would feel better knowing that there was another experienced nurse able to watch over my other patients.
One thing that I don't want to let you get away without at least touching on. And last week I got a letter telling me that my data had been compromised in some way, and 2 years before they got the letter. By the way, I got the letter 2 years later. Like 2 years ago, this happened. Okay, thank you. So what about privacy? There's a lot of technology and a lot of fiber optics, a lot of cable running between this. What about privacy and security?
Sure. We are in a secure location, so we're not. We don't have the public constantly walking past our workstations. We utilize the electronic medical record, and we follow all HIPAA guidelines and protocols. I know there's been a lot of concerns about the AV equipment. You have someone that's remoting into the room, and you may be in a vulnerable position that you wouldn't necessarily want someone to be cameraing into your room at that time. The nurses are very experienced, and they are also communicating with the bedside teams. So the bedside teams have been great to say, hey, we're going to give this patient a bath. Please don't camera in for the next 30 minutes. Hey, we're going to be doing this procedure. Can you not camera in for the next hour? things like that, and just that communication. And then, of course, if the nurse does camera in and it's not a good time, the nurse will politely remove themselves from the room.
And we have a privacy feature that lets us click
Yes.
not to camera in. So if there's 2 or 3 of us, the eICU nurses there, not just I see it if it was my patient, but like my colleagues can see it as well. So we all know, not to go into that room at this time. They've requested privacy. So we have that filter for our AV technology.
Some of us are going to know someone who's been in ICU or who's going to be in ICU. And this is a lot of information that helps because it takes the strain off of some. They don't have to leave the familiarity of where they are to get the care that they need. I think before I let you get away, I want to ask each of you, where do you see this technology going beyond where it is?
I hope that we'll just continue to expand. There are several other platforms and things that can be done where you can have things like virtual sitters. You can have virtual nurses that are able to do discharges on the floor, things that take very time-consuming tasks off of the bedside teams, and it's one dedicated person that would be, that you could have one nurse doing the entire floor.
I really don't have a whole lot to add to that because I think that's where all of our hopes are that this will go. I mean, the sky's the limit, technology, what was it? Field of dreams. If you build it, they will come, so, we're looking to build something that not only gives that competent, compassionate healthcare, but also inspires the patients, makes them feel like, hey, West Tennessee healthcare is giving me the absolute best in patient care that there is to offer. And so that's what we want to build on that, and how far it grows, sky's the limit, I believe.
Yeah.
Thank you both. Thank you both for being here. Thank you for everything that you do and for letting us know here at We Talk Health, kind of the present and the future of where this is going. You had one more thought.
Well, I was just going to say, this technology has been around for 25 plus years. So we're very excited that we were able to bring it here to West Tennessee and to the West Tennessee healthcare system.
I want to thank you both also for the service that you've given to the community as healthcare providers. It's a stressful and highly anxiety. I mean, you have your own anxieties. You see a lot that you have to forget and deal with, and a lot that you can't take home. And in the course of your jobs, you can't even talk to anybody about it because you can't really share what this particular process or patient went through. So thank you for everything that you do. Thank you for coming in today to We Talk Health.
Thank you.
Thank you very much for having us. And I'm going to send that shout out that you just gave to all of our colleagues too, because it's just an amazing job around West Tennessee healthcare. So if any of them are listening, I thank them for everything that they do every day, taking care of these patients.
Join you in that too. This has been We Talk Health.